Hello, and this is Ghassan Abou-Alfa. Welcome, and nice to hear about all those wonderful things, and nice to attend and see them in personally at the World GI in Barcelona. And I'm very grateful to have been invited to really, as faculty, as panel member, as well as discussant for many, many components, among which first, number one, is are we ready to integrate systemic therapies for HCC in early stage disease? And of course, what's early stage disease? The one that we'll probably think mostly about is definitely adjuvant therapy. And yes, we can say that this is an exciting subject. We all know that we've been trying it forever, and so far we didn't really have success. There has been, like, remember, retinoic acid, some potential benefit, but it was a long benefit that's seen after 5 years. But really, we don't have a standard of care for that disease in regard to adjuvant therapy. And the IMbrave050 tried to answer that by actually giving, after surgery, a combination of Atezolizumab versus active surveillance. And there was actually a improvement in regard to the outcome of those patients. So know that in regard to the IMbrave050, very important to remember that this is only in abstract format, and we have to wait for the full data to be presented in a manuscript format, because there's a lot of concepts that were yet to be understood in that regard. Still, we're happy to see a 17.4-month recurrence-free survival in regard to Atezolizumab plus Bevacizumab versus 12-month recurrence-free survival for the placebo or active surveillance. But again, we need to see the full data. The argument that Dr. P.S. Chow, who proudly presented the data at AACR, and then we had an update on it at ASCO, and now we have one at World GI, is yet to really be in manuscript format, so we understand better what it means, especially that argument about an early versus late stage or late phase recurrence, and to understand better if this is going to become a standard of care or not. I'm, of course, delighted to see that positive data, great response or great outcome rather. But definitely we need to do a little bit more before we can commit to it as being standard of care therapy.